As Melissa said, I work for a company called ServiceLink. In every county in New Hampshire, there's an office called ServiceLink. We are there to provide a variety of services to people. What happened a number of years ago, the federal government, Social Security Administration, who oversees Medicare, the health insurance program, went to each state and said, in your state, you must designate a program called the State Health Insurance Assistance Program. They dropped the A so that they could call it SHIP. So each state had to go look around and find an organization that said, you're going to be the people who meet with people and offer free advice, information, training seminars, etc., about Medicare. And the New Hampshire Department of Health and Human Services went to each ServiceLink office that you're going to be the one, and you're going to have to meet with people, you're going to have to meet certain criteria so that when people come to you, they will know that they're in good hands with Medicare. So we actually have to go through certain certification. Every year we have to take a test and so forth. I absentmindedly forgot I was going to bring you a copy of what was the new to Medicare handbook that is put out by the federal government, because in the back it said, in New Hampshire, call ServiceLink if you need some advice. And I'm going to say, that's our reference. If you need a reference to make sure that I know what I'm talking about, the federal government will give you a reference for ServiceLink. So I just wanted to make sure you understood what ServiceLink does when it comes to Medicare. We actually will play 3 roles with you. If you're new to Medicare, today would be hopefully an introduction to you, learning about what Medicare is all about. Medicare being the federal health insurance program. That's the first step. The second step is each of you has choices that you need to make when it comes to Medicare. I'm going to grab you the packets. And so when it comes to making your individual choices, we have an office in Stratham. We also have an office in Rochester, and we're working on some satellite office over towards Atkinson and Salem. We will sit down with you individually and look at your particular situation so that you get the Medicare coverage that you want. And the third is, it's always helpful to have kind of an ongoing review of what your Medicare coverage is, and that's something that we would provide. So I like to think that we will provide 3 roles. So today, as part of an introduction to Medicare, I want to talk a little bit about who is eligible, who gets Medicare. If you're not already enrolled in Medicare, I want to talk about how you get enrolled in Medicare. And then I want to get into what's the most important thing, is understanding what it means that Medicare becomes your primary health insurance. There is a lot of information out there. A lot of people tell me they're very confused about Medicare. It is my goal to present it in a way for you so you're not confused about what it means when Medicare becomes your health insurance. As you've heard the expression, there are no bad students, only bad teachers. So at the end of this, if you're still confused, I did not do my job. Not you, it's me. It's the bad teacher. So let's just quickly talk about eligibility. For most people who have Medicare, it's because of your age. When you turn 65, the federal government offers you this health insurance called Medicare. That's the number one reason. That's the number one category of people who are enrolled in Medicare. But there are a couple other reasons why people might have Medicare. If you are collecting what is known as Social Security disability income, and you've been on this Social Security disability income, it means you're not yet 65, and you've been collecting it for at least 2 years, the federal government gives you Medicare as your health insurance. And the other category are people who have unfortunately been dealt with are dealing with 2 very serious medical conditions, and end-stage renal disease, and ALS, known as Lou Gehrig's disease, they, regardless of their age, can have Medicare become their health insurance. So, again, for most, it's because you're 65 or older that you become eligible for Medicare. Is there anybody here who is reaching that category, turning 65, has not yet signed up for Medicare? Okay. 18 months. Okay, all right. So let me quickly talk about enrollment. Okay. If you are turning 65 and it's time for you to sign up for Medicare, one of two things will happen. You're either going to be automatically enrolled in Medicare by the Social Security Administration, or you're on your own. If you are already collecting Social Security income, like I said, if you're on Social Security disability income, or you opted for what is known as early retirement for your Social Security retirement income, you can start collecting Social Security income at the age of 62, if you choose to. So the Social Security Administration said, if you're already in our system for some reason, we're just going to sign you up for Medicare. We're just going to send you all your information and enroll you in Medicare. If you're not collecting any Social Security income, you're not in the Social Security system, you're on your own, take responsibility to sign up for Medicare. And that means you enter into your initial enrollment period. Your initial enrollment period begins 3 months before you turn 65, the month you turn 65, and 3 months after that. So they give you a 7-month window. So for example, I happen to be on Medicare. My birthday month is November. My initial enrollment period, the year I turned 65, was August. It was August, September, October, 3 months beforehand. My birthday month, November, and 3 months after, December, January, February. So I had that 7-month window to sign up for Medicare. During that initial enrollment period, I had 2 options to sign up. I could have called the Social Security Administration and said I want to enroll in Medicare, and they would sign up with me over the phone. Or I could go online and sign up, which is what I opted to do. So those are your options, but it is your responsibility to sign up for Medicare when you hit your initial enrollment period. Okay? Now, when you are in your initial enrollment period, there are 2 things that are going to happen. And this is something that is confusing to a lot of people. If you have no other options for health insurance, basically, you have to sign up during your initial enrollment period. If you have no other options for health insurance, Medicare is really your only option. You're going to have to sign up for Medicare during your initial period. If you don't have any other options, and you don't sign up for your Medicare during your initial enrollment, you face the risk of being penalized for missing your initial enrollment. Again, if Medicare is your only option for health insurance. But the Social Security Administration and the ones who oversee Medicare said, we're going to give you a second option. It's called credible other insurance. And if you have credible other insurance, you do not have to sign up for Medicare. What is credible other insurance? It must meet the following criteria. You are working full-time, or you are married to somebody who's working full-time, they work for a company with at least 20 employees, and they have health insurance, and you have health insurance through that company. So again, you're working full-time, your company has 20 or more employees, and you are enrolled in your company's health insurance program. Or you're married to somebody working full-time, company has 20 or more employees, and sign up for health insurance and put you on that policy. Okay? The reason that they come up with that number, 20 or more employees, they said the insurance that other insurance you have through work must be as good, if not better, than the coverage you're going to get from Medicare. Lou's Auto Body Shop across the street, there is no one, has 5 employees. Now, if you know anything about the health insurance industry, they want to make money. Big surprise. They got Wentworth Douglas Hospital with 3,000 employees. They will bend over backwards to make sure that they get everybody at Wentworth Douglas Hospital to sign up. Why? Because that's 3,000 monthly premium. Lou's Auto Body calls the same insurance broker, and he couldn't care less because he's only going to get 5 premiums. So he creates a policy for Lou's Auto Body that's not very good. But Lou can go to his employees and say, here, this is the best I can do. And the Social Security Administration said, Lou's Auto Body's health insurance, there's no way it's as good as ours. That's why they came up with that number. They know, Social Security Administration knows, a small company, one person owned company with small employees, their health insurance policy isn't as good as what we give them. So that's very important for people to know. If you are covered by a policy that meets this credible, and this is very important to know, you don't have to sign up for Medicare, because the rumors you'll get hit. Neighbors, coworkers, if you don't sign up for Medicare, you're going to get penalized. You're not going to get penalized if you meet the credible coverage. And we get plenty of people who tell us, like they work for a Wentworth Douglas Hospital, or they work for a town that has a lot of employees who have combined with other towns to get, a great municipal policy. And the reality is, they have such a good policy that it's better than the coverage they would get if they went for Medicare. They don't have to sign up for Medicare. And we get people, I'm fine, I'm good. I'm not going to sign up for Medicare until I leave my company. So, again, you're the only one that would fit this category. So, if you're working now full time, you don't mind asking. Okay, if you work and you love your policy, you call me and say, fine. I can't remember the details, but a couple of weeks ago, I said, I practically screamed at somebody, don't you dare sign up for Medicare, after she told me what a policy was. She was playing with peanuts. It was just like, I had never seen a work-related policy as good as her. And I was practically screaming at her, don't you dare sign up for Medicare. Don't you dare drop this one. And she was good. She was just going to do it and call whenever she left. Now, if you don't meet the credible coverage, you have to sign up during your initial period, that 7-month window. If you meet the credible coverage policy, and I also want to point out, I mentioned you have to be working full time, because in some companies, when you retire, they will say, well, you've been a long time employee. We offer this insurance policy for people who retire from our company. That's called a retiree policy. That's not credible. A retiree policy is not credible. There are a few exceptions with the federal government that I won't get into, but that's not, you have to be working full time.
Is it because the retiree policy is not as good?
I just think that they just want to get people into Medicare. There's some things they do I don't answer. Okay, that's the way it is. As long as I give people the proper information, I don't have the time to figure out why. It's the federal government. So, now, if you do, I will just very quickly, because it doesn't pertain to the four of you, but somebody you know, if you did have credible coverage, so you're 65, you call me and you tell me the coverage, that you don't have to sign for Medicare, well, I'm not, okay. You're 66, 67, 68, you're still working, you're still happy with this coverage. When that policy ends because you retire, you now go into what is known as a special enrollment period. You have 8 months to sign up for Medicare. Now, 4 of us, 5 of us are smart enough to know we don't want to go one day without policy. But the Social Security Administration is flexible. You don't have to sign up right away. We're going to give you 8 months. But that's such a, it's irrelevant to 5 people who know better that we don't want to go one day without it. Okay? So any questions about the enrollment? Okay. Now comes the important part. We explain to you what it means for Medicare to be your health insurance. Have the 4 of you been told how confusing it is to understand Medicare? You're smiling. You're either nodding your head or you're smiling. There are no bad students, only bad teachers. And this is something, I've been doing this for 8 years. Actually, today's my 8th anniversary on this job. It's our fault, meaning the people who teach, and I'm going to tell you why. I'm going to assume the 4 of you are like me, that you've had health insurance most of your adult life. Right? The 4 of you understand how health insurance works. So why would we say when you turn 65 you don't know anything about health insurance? We have to teach you. We don't. All we have to do is take what you already know about health insurance, because you've been on it most of your adult life, and just do a little tweaking here and there. We don't have to act like you don't know anything about health insurance. If you do, because you've had it and you've known what to do about it most of your adult life. And that's where I part company with a lot of my colleagues. We need to just remind people you're already smart when it comes to understanding health insurance. And I'm just going to build upon it. Okay? Why do I know that you know a lot about health insurance? Because the first thing you understand about health insurance, and this, by the way, does not apply 100% to all of the men. What do you know about health insurance? Health insurance for most Americans is not free. Every paycheck, there it was, but you were paying for health insurance. It wasn't free. You know that. Okay, right? Medicare is the same way, and I will talk in a moment about those costs. Actually, you know what? I'm going to do that now. Medicare has a monthly premium. Now, Medicare did something different. Talk about why it happened. I was just a kid when they set up Medicare. It's the federal government. They had to muck it all up, right? They had to muck up Medicare by doing this. Let's create these 2 parts. Let's call them Medicare A and Medicare B. Up till that, all we had was a health insurance card. Nobody said Anthem Part A and Anthem Part B or Tufts Health. They just said Anthem Tufts. No, Medicare just says Part A, Part B. Okay. Nothing we can do about it. And each of them carries a premium, a monthly premium, to pay the insurance company. Now, if you've worked at least 10 years of your adult life, you don't pay a Medicare Part A premium. How many of you have been told Medicare Part A is free? How many of you have heard that expression? Okay? You work at least 10 years of your adult life? Did you work at least 10 years of your adult life? Have you two worked at least? You understand that every paycheck, there were the 2 taxes, federal income tax and Social Security tax. You know what that Social Security tax went to? You're telling me it was free? I'm saying this jokingly. Go right ahead and say that it's free. It's prepaid. Okay, you pay for it. Okay, federal government isn't going to give you health insurance. I just like to be a little lighthearted about it. It's prepaid. Now, the way we know that, let's just say I never worked my adult life and I go to sign up for Medicare Part A. And the four of you worked your entire adult life and paid Social Security tax. Would they give me a zero premium if I didn't work while you all paid thousands of dollars? That wouldn't be fair. Right? I don't work my adult life. You guys pay thousands of dollars, since 20s, 30s, 40s, 50s, 60s, whatever. And part of that goes to Medicare Part A, so you pay thousands of dollars. I decided I wasn't going to work. I signed up for Medicare Part A and say, okay, you can have the same deal they pay. No. If you haven't worked at least 10 years of adult life, you will pay a Medicare Part A premium. And if you have worked less than 8 years of your adult life, the premium is close to $500 a month. If you've worked 10 years, the premium is like $300 a month. Why? Because if this were me, they're saying, Andy, you have to make up for lost time. All these poor people paid thousands of dollars, you haven't paid a dime, now it's your turn. If you know any adult who think you're, fooling the system by getting paid under the table, when they go to apply for Medicare and they haven't paid Social Security tax, it will catch up to them. Does that make sense? You look a little confused.
I'm just kind of curious, what happens if you're a spouse and haven't worked?
There's exceptions. There can be some exceptions, or you might have to pay a premium. You might have to pay a premium.
It's not me, but
I know. It can happen. You might have to pay a premium because everybody else did. So now, Medicare Part B. Medicare Part B, by the way, is what they call hospital coverage. Medicare Part B is medical coverage. Hospital coverage, anything to do with being hospitalized, Medicare Part A pays. All the stuff that has nothing to do with the hospital is Medicare Part B. That carries with it a premium that you have to pay unless you're on limited income. And every state has guidelines. If your monthly income is below a certain amount and your resources or assets are below a certain amount, your state's going to pay the premium. If you're above that, you will pay the premium. In the state of New Hampshire, you're looking approximately about $1,600 a month. If your income is below that, and your resources, if you're single, well, that's a single person, are below 10,000. If you're married, it's about 2,000, and your assets are under 15,000. The state may pay your Medicare Part B premium. Otherwise, everybody pays the standard.
up to a certain income limit.
Up to a certain income level. If you're single, if your income level is about 95,000 or more, and a married couple, it's 190,000 or more, you'll pay a higher premium. It's like income tax. They'll raise the premium. I had a friend of mine, he and his wife were very successful lawyers. He turns to me for Medicare help and complains because they have to pay the highest premium. I've known him from high school. I said, Peter, I admire all the hard work you put in. I've known you since high school. You're making a heck of a lot more money than me. You're not getting any sympathy from me about it. So, anyway. So that's the cost. Those are the premiums, pretty straightforward. But now comes the big deal. If you take anything out of our meeting today, please take the following out of it. Because what I'm about to tell you will drive every decision that you make about the Medicare coverage that you want. And this is where people start to get confused. And this is where I say to my colleagues, they should not be confused because they've known this for decades. In America, for most Americans, health insurance says to you, the health insurance company says to you, you owe us a monthly premium. And then when you go to use your medical service, you go to Dr. Jones, you go to Exeter Hospital, you go here, you go there, the insurance company is going to get a bill. What's the insurance company going to do? They're not going to pay 100%. If the health insurance, when they created health insurance in America, the health insurance companies way back when said, we're going to pay 100% of the bill, class this. That's it. Here's my health insurance, I'll pay the bill, thank you very much. But all the confusion that gets created about Medicare is because Medicare does the same thing that Anthem or Tufts or Cigna or Humana and all the private insurance companies do for most Americans. They don't pay 100% of the bill. And that's what gets people all stressed out. Why? Because it works like this. You get health insurance, whether it's private insurance or Medicare, you pay a monthly premium. The insurance company says, when we're going to insure you, and when you use your health insurance and we get a bill, we're going to pay most of it. But you are going to have to pay more. So even though you're paying us, you're not done paying. You will have to pay a portion of the bill. And your portion of the bill is sometimes referred to as a copayment. It's also sometimes referred to as co-insurance. It's sometimes referred to as out-of-pocket expense. So you have a right to go back to the insurance company and say, so you're telling me I'm giving you money every month. When you get a bill, I'm still going to have to pay something. They say, yes. My next question to you, insurance company, is, how much? Okay, you just told me. You're not going to pay all the bills. I'm going to have to pay something. How much am I going to have to pay? Reasonable question, right? You know what their answer is? We don't know. Great, thanks. That was real helpful. You're telling me I could pay $50,000 if I went up a week in a hospital, 2 weeks in a hospital. The insurance company says, could be. Next question then. Let me ask you this, insurance company. Can you at least tell me there's a limit? And the answer is, and this is Medicare. You pay the federal government. They tell you, you may pay us, but you're still going to have to pay a portion of the bill. You say, how much? They say, we don't know. You say, well, can you at least give me a limit? And their answer is, I have terrible handwriting, so I'll have to read it to you. Yes. We'll tell you what the limit is on how much more you're going to have to pay after you pay the premium, only if you choose wisely. Because if you don't choose wisely, there is no limit. And that is what all the confusion is about. It is very simple. There are 3 choices that you have to make, and people don't know which choice to make. And the reason they can't figure out which choice to make is nobody has taken the time to explain this concept. When you are on Medicare, you need to make sure you have chosen a coverage plan that's going to put a limit on how much you have to pay. Because, and this is why I go back to I'm one thing away from this. Your insurance company is not gonna pay 100% of the bill. And if you don't choose wisely, this could hit you, and hit you hard. And if you choose wisely, you'll put a limit on it. Does that make sense? Is there anybody who doesn't understand what I'm trying to say here?
Sounds like you're trying to say that it's like the different tiers of.
Absolutely. But you already know that. You already know that. You've already known all of this because you've had health insurance most of your adult life, and you had health insurance that put a limit on it. Okay? So what we're saying is, we want a policy that's going to limit how much I have to spend. Isn't that basic knowledge? Isn't that a basic thing to want? Who would want a policy that says there's no limit to how much it could cost you? I wouldn't. So what I'm going to try to do in the remaining time is explain to you the different options so that you can understand what that means. But again, it's all going to come down to, because we're dealing with the world of insurance. We can call it Medicare, we can call it health insurance, we're dealing with the world of insurance. And the purpose of insurance is to limit our financial liability. We buy automobile insurance to limit our financial risk. We buy homeowners insurance. You go to Best Buy and buy a television and you buy the service plan to limit your financial risk. So, when it comes to Medicare, you have three options. Okay? The first option is known as original Medicare. I like using visuals in these presentations. Sometimes it's easier to explain. This is my Medicare card. This is my Medicare card. This is every time I go into medical practice, they ask me for my health insurance. I give it to them. I had the option of saying, and that I'm paying $165 a month. And I had the option of saying, that's my insurance. Everywhere I go, I'll get the Medicare will get a bill, and a few weeks later, I'll get a bill, for the rest. Just like I've been doing prior to I was Medicare. To the core, you understand the concept of what is called out-of-pocket max. If you don't, okay, basically it says, the insurance company knows how much you have to pay each time. Andy, this time you had to pay $20. 3 weeks later, you had to pay $40. And they keep a running total. Now it's up to 60. Now it's up to 100. And when you hit a certain max, they keep track. They say when you're done, when you hit that max, Andy, when you have to pay all those co-payments, we're going to cover you 100. So the insurance company said, we put a limit on it for you. In addition to paying the monthly premium, we put a limit on how much more you have to pay. So, if I opted for this to be my primary insurance and nothing else, I have to pay the co-payment. The federal government's response is, we think we're being very generous. You're paying us $165 a month, and every time you go to the doctor, bids you or hospitalized, we're going to pay most of the bill, but you're going to pay the rest. You know how generous they think they are? They don't put a limit on it. They don't put a limit on the co-payment. not put a maximum on the co-payment. God forbid I was hospitalized for a week. We know a week in a hospital now could be $150,000, $180,000. The federal government will pay $150,000 and think they're being very generous. And then when I get the bill for $30,000, and I turn to the president or the Senate or the House of Representatives, they're going to say to me, "What do you want from us? We paid $150,000. You pay the rest." The federal government says there's no limit. There is no limit to how much more you will have to pay if you have a lot of medical bills. Does everybody understand that? If the bill's $30,000, you pay. If the bill's $3,000, you pay. We don't care. We paid most of it. What do you want from me? That's their attitude. They think they're being generous. How many people in this room would like to have an insurance policy like this? If we were 25 years old, we'd be fine with that. But as I like to say, we're not kids anymore. We're a little smarter than that, right? We don't want this, right? Would anybody be comfortable? Because it's the least expensive. It's not going to cost you any more than the monthly premium. That's the policy you get. When we meet with people individually, I don't like to tell people what to do. Well, you should do this or do that. I make recommendations. You want to know? Would you like to know what my recommendation is for this policy? I would not recommend, at this point in our lives, a health insurance policy that says you pay 100% of the co-payments with no relief in sight. I wouldn't do it. Does that make sense? Everybody clear? That's option one. And if I read the room correctly, we're all in agreement, unanimous. But that's not an acceptable option. Okay? Here's the good news. The other two options are going to put a limit on it. Okay? Federal government gives you that option one. We agree it's not acceptable to us. That's the good news. We don't have to take it. We go to option number two. We pay the federal government the Medicare Part B premium. And then we contact a private insurance company and say, let's do business. If you do it when you're first eligible for Medicare, they by federal policy, they have to agree to business. They can't turn you down. They have to agree. And so what they do is they sell you another policy depending on your age and your gender. Approximately, it might be a little less, might be a little more, the same amount of money. So now you pay two premiums and you get two cards. In my case, when I signed up for Medicare, I got the card from the federal government. I contacted the Harvard Pilgrim Company and I said, let's do business. And they didn't have a choice. They had to do business with me. And this is how it works. I go to Dr. Jones, God forbid I'm hospitalized, I hand him my Medicare card. I also hand him the Harvard Pilgrim card. Medicare gets the bill, pays most of it. They pay the rest. And I don't have to pay. But every month, they get approximately this amount of money. So what happens, January 1st to December 31st, if it depends on a calendar year, I don't use my health insurance once. Not once, but I use my health insurance. Pays my part. I don't have a physical, I don't do anything. Every month, Harvard Pilgrim gets money from me, but I don't use it. Do they send the money back? No. No, they keep it. Think of this like the insurance policy we all have, I think. Automobile insurance. I'm hoping that none of us has been in a car accident in a while. Sorry if you have. If you haven't, think about all the money you spend every year because automobile insurance company, and they don't lift a finger. They don't even send you a gift card at the end of the year to thank you for the money that you spent with them, and they did nothing for it. Okay? Now, I could bring out all kinds of charts and statistics and whatever, and say to you, do you have any idea the odds in your favor of not having a car accident? What do you need automobile insurance? The odds are so stacked in your favor, you won't have an accident. And the four of you would look at me like I'm nuts. There's not a chance that you would cancel your automobile policy. So why you have it? Just in case. I'll send Harvard Pilgrim money just in case. Now, what winds up is I send them about $2,000 every year. What they pay out in bills, I believe, since I've had Medicare, I believe they've made money on it. So they gamble. They didn't have a choice. The federal government said, Andy contacted you, you don't have a choice, you have to sell them this policy. And they gamble. What happens when you gamble? Sometimes you win, sometimes you lose. When I'm happy, I'm happiest when I'm healthy. When I'm healthy, they win. Because they got more money from me than they paid out. God forbid something terrible happens to me. I'm not happy because I'm not healthy. And then I'm happy because they got a $30,000 bill and they only got $2,000. That's the gamble that they have to pay. And that's the decision you can make. And what you've done is you've limited. Your co-payments are taken care of by the insurance company to the tune of a monthly premium. So that's your limit. Option number two. Option number one, there was no limit. Option number two, we limited. Make sense?
This is like a gap policy.
That's the same thing. I'm using the term supplemental. I apologize. You'll hear it sometimes referred to as Medigap. They mean the same thing. So sometimes I say Medigap, sometimes I mean supplemental. I should use both. I should try to remember to use both so you understand. It's potato, the same thing. Okay? Now, so I opt for that insurance to put a limit on it. But my insurance coverage is not complete. Anybody know why? I do not have prescription coverage. The federal government doesn't help me pay for prescriptions. And since they don't help me pay for prescriptions, it's easier to target. Actually, before I go on, I want to also point out, these two only work in partnership if I go to somebody who accepts Medicare. I have to go to somebody who accepts Medicare. Dr. Smith opens a clinic across the street. I hear great things about Dr. Smith. I call Dr. Smith up to schedule an appointment. They say, what's your health insurance? I say Medicare. They say, we're not a Medicare provider. I can't use my Medicare insurance. Harvard Pilgrim has nothing, does nothing. Harvard Pilgrim only goes into action when I went to a Medicare-approved provider. Medicare got the bill, paid most of it, and the rest went to Harvard Pilgrim. But they don't pay for prescriptions. So what I had to do was go to a third insurance company and say to them, I need to do business with you because I need help paying for my prescriptions. I go to CVS every few months. The pharmacist puts down the bottles. Instead of charging me full price, the insurance company helps me pay for it. And in my case, it's the insurance company. Okay? Here in Rockingham County, there are well over 20 of these plans to choose from. Each plan is designed to meet your specific needs based on your particular prescription and your particular choice of pharmacy. I can't give you a blanket message on how much it's going to cost. Each one is individual. I can tell you the range. I happen to be very fortunate on inexpensive medication. My monthly premium is only $4.20. There are much more expensive plans. So what we do, when I said we can meet with you individually, we will look at there's a website, Medicare.gov, that will tell us specifically, based on the medications you told Medicare.gov, we're basically shopping online. You told me you take this med, this med, this med, this med. This is your choice of pharmacy. This is the plan that's going to save you the most money. But, yeah,
Would your other insurance company pay for your Medicaid?
no,
To a certain
nothing. Nothing, nothing.
I say that is, my medication's covered up to, if it's generic, but it's not covered if it's,
Medicare does not pay for prescription.
well, I don't Medicare then, 'cause I don't have Part B.
Okay. So how are you paying for your prescription?
The other health plan, yeah.
You must have something else. You have something else. You must have something else. So if I haven't gotten to it. If you, okay, you probably have another type of policy.
What? It's the federal government.
You must have a type of policy, which is the third choice.
But it only covers part of the medication. Doesn't cover.
It doesn't cover 100%. No, they don't cover 100%. When I go to CVS and they put the bottles down, the pharmacist says, Andy, you owe us this much money. I have a co-payment. I still have a co-payment,
Okay.
but I'm not paying 100%. The insurance company's paying most of the money for the prescription, and I have to pay the rest.
Okay.
Okay? Yeah, no, it does not cover 100%. Some very cheap medications, they might. Some very inexpensive ones, they might say, give it to them for nothing. But the expensive ones, no. There's a co-payment that goes with it. With the prescription plans, you pay the company a monthly premium, and then you also pay something at the pharmacy.
Right, because I have to pay $90 worth
Yeah.
if I get.
Yeah, so there's something. Okay.
Do these prescription plans usually have limits?
There are certain rules and regulations if you're on expensive medications. There are stages you have to go through. It's not, I don't want to go into the details. There are, they call it, gaps. There's certain, there's coverage gaps. So they'll cover you this much till this point, then you have to pay more, and then you have to pay less.
And then there's catastrophic.
Yeah, right. So but those are the type of things, when I do a seminar like this, I believe in information overload. I believe that there's only a certain amount you want to cover in the first, so I don't try to go into the details.
Yes, they're doing that.
The first, yeah. Right. So that's option number 2. What you basically said is your biggest cost after you pay the Medicare Part 3 premium is to pay the insurance company, in my case, Harvard Coverage. So you're looking, if you're around 65 years old, you're basically saying, I'm going to spend maybe around $2,000, maybe up to $2,200, depending on your prescription. And that's it. That's the limit that I put on. I paid the federal government. They paid most of the bill. It's going to cost me $2,200. No more, no less. That make sense? Okay. That's option number 2. How many people are getting junk mail from the insurance company? You're not getting any junk mail? Good for you. Okay. When you turn 65, I don't know who spilled the beans, they know it. They start targeting you, and they don't stop. Martin's Point, Humana, United Healthcare, okay? What they're saying to you is do business with us. What they're talking about are Medicare, what are called Medicare Advantage. They are private insurance companies that are saying to you, we can offer you a better deal than the federal government and supplemental. We can offer you a better deal. So don't use Medicare and don't buy a supplemental plan. Deal with us. Federal government said, that's fine. If that's the route you want to go ahead. We have no problem with you wanting to go to a private insurance company to be your insurance company. However, federal government said, you still have to pay it. You still have to pay the Medicare Part B premium. As far as I'm concerned, it's tax. As soon as you enter the world of Medicare, they said, you're paying the Medicare Part B premium. We don't care what you do. But what you say is, in terms of my insurance coverage, the company that's going to pay my bill, I'm not going to turn to the federal government. I'm going to turn to a private insurance company. Companies like Martin's Point, Aetna, by the way, it's retirement.
Just an hour, so like 15.
Okay, sure. Aetna, and it could be whatever it is. That's going to be my insurance company. I sign up for it with them. They send me the card, and just like you did for decades, that one card took care of everything. It took care of your doctor visits, your hospital prescriptions. It was one-stop shop. That was your health insurance. What they did was, they came up with a plan to try to convince you to do it. They convinced the federal government to help them out. And this is what the federal government said. You're already paying us, but you're not turning to us to pay your bills. So we're going to take this money and we're going to give some of it to the private insurance company. So the private insurance company said, thank you. Since you gave us some of this money, we're going to give it to the consumers. Here in Rockingham County, there are over 30 of these plans that you can choose from. Almost half of them, because they get subsidies from the federal government, said, we're going to do this for you. We're not going to charge you a monthly premium. You can actually sign up for a health insurance plan and not pay an additional premium. Because you're already paying the federal government and they're giving us some of that money. You're paying the federal government and you're not using them as your insurance company, so they gave it to us. Pretty good deal. But now consider this. I said to the Harvard Pilgrim Company, I'm going to give you $2,000 to pay my bills. Okay? You decide to go with an Advantage plan and say, I'm not spending an additional $2,000 to have an insurance company to pay my bills. The bills don't go away. Who has to pay? You do. You said, Harvard Pilgrim can get $2,000 and pay my bills, or I can save $2,000. I'll pay the bill. That make sense? Any questions about that?
Yeah, I don't understand.
Okay. All right. I'm sorry, I should have put that. Co-payment. Remember one thing. Health insurance companies in America don't pay 100% of the bill. Okay? I signed up for an insurance company. They get a bill. They don't pay 100% of the bill. Somebody has to pay the rest. I said to Harvard Pilgrim, I'll give you $2,000 to pay the bill. You said, I'm not giving Harvard Pilgrim $2,000. Who's gonna pay the copay? Does that make sense?
So there's not a limit on this. You're paying.
Hey, you jumped ahead.
Oh, sorry.
You jumped
I
ahead.
was understanding, I just wasn't.
However, with the $2,000, yeah. With the supplemental plan, the Medicare plan, that's why I gave Harvard Pilgrim the $2,000. That's why Harvard Pilgrim gambled. They said, we'll take your $2,000, Andy, and we're gonna pay your copay, because we don't think we're gonna pay out. No. No. But remember, the original Medicare by itself, there was no limit to the copayments, right? But these are private insurance companies. And this is why I say, Melissa, you've known this ever since you had health insurance. Private insurance companies will put a max on it. Just like the insurance you have now. So what you decided was either pay the $2,000, or pay the bills. Now, this is Harvard Pilgrim. This is Melissa getting an advantage. Okay? The insurance company says, Melissa, we're going to put a maximum on your copay. And with these zero premiums, the maximum is $6,700. That's the most you're going to have to pay. So she opts not to get paid Harvard $2,000. God forbid she has a lot of medical bills and hits the max. She would have been better off supplemental, right? Right? What's the least amount she could pay?
$165.
After 160. What's the least, after this? What's the least amount you could pay in copay?
Zero.
Bingo. This is the advantage plan. Melissa gets an advantage plan. Worst case scenario, $6,700. Best case scenario, she never uses her health insurance once or goes to primary care physicians 3 times with a zero copay. How much is Melissa going to pay? We don't know. It's going to be anywhere from 0 to $6,700.
So
right?
this is your high deductible option.
It's not a deductible. It's out of pocket max. It's just co-payments. Your co-payments, what you have to pay after you pay $165 to the federal government, it's going to be anywhere from 0 to $6,700, right? Meanwhile, my left hand is what Andy's paying every year. Melissa has a healthy year, Andy paid more. Melissa has a bad year medically, Melissa paid more. Over on the left hand, Andy decided to just do whatever. Thinks he's playing it safe. Melissa decided to give.
And do the insurance companies compete by saying what that out-of-pocket max is?
They're all pretty much the same. Does this make sense? Does this make sense? This is me with a supplemental plan. Everybody in this room pays $165. Forget it. That's it. You're in the world of Medicare, everybody pays $165. Remember, it all came down to what else after I paid the premiums? How much more was I going to have to pay? I said I'll go with the $2,200 and go with a supplemental plan. Melissa said, no, I'm going to take my chance. I'm thinking I'm healthy. I'm not going to give any insurance company $2,000. Melissa's co-payments are $30 for the year. She saves $2,000. Melissa has a bad year, winds up having a lot of medical bills. It costs Melissa an extra $4,500 or so, and more than me. Does that make sense?
Is that a realistic price you're giving, $6,500?
Yes. Yes.
But your advantage usually has a drug plan attached to it.
What's that?
Your advantage plan.
Yes.
Your drug plan. Well, your drug plan is only for.
That's correct. The Advantage plans include prescription. They also include some dental, some vision, and some hearing coverage,
Which you're not covered by.
which are not covered by, I don't have it. I don't have it. Okay? I don't have it. So what it comes down to, now again, because I believe in information overload and there's just so much you can cover in 1 hour, what I wanted you to understand is the basic concept of what your choices are. Option 1, no max. Option number 2, depending on your specific circumstances, might be you will pay the $2,000 to $2,200. And option number 3, in all 3 cases, you're paying the Medicare Part B premium. So this is not about the Medicare Part B premium. This is about saying to the federal government, you told me after I paid the Medicare Part B premium, I have more money that I will have to pay. And you told me in option 1, the sky's the limit. That's not acceptable. So I went to option number 2 that said, all right, I agree. I'll pay $2,000, I'll pay $2,200. Or in option number 3, I'll pay anywhere from 0 to $6,700. When I say the $2,200, I'm factoring in roughly the prescription. Does that make sense? That's the basic understanding of what Medicare is about. What comes next? Individual choices. I would meet with you and I would look at what are your specific needs? What are your specific prescription costs? If your prescription costs are outrageous over here, you might want to go with an Advantage plan. If dental, vision, and hearing is a priority, let's look at every Advantage plan has different levels of dental care. Let's look at that. Okay? So there's more to, I understand this is just kind of a tip of the iceberg. But if you don't start with the basic concept, the rest will continue to feel like a maze that you're lost in. If you come away with the understanding, I need to make a decision that limits my financial liability, because that's what insurance is all about. Then you leave here recognizing I understood more than I realized. Because I've been dealing with health insurance, homeowners insurance, all this stuff, which is all designed to limit my financial ability. And if you haven't understood what I've said, there are no bad students, there are only bad teachers. Does this basic concept make sense? That's all I really care about the first time I meet these people to explain what Medicare is about. The basic concept. We'll get into the details later. But if you understand the basics, the details will make sense. If you try to go into the details too quickly without understanding the basics, you'll be lost. Okay? Anytime any of you wants to meet, you call ServiceLink. Now, I work mostly out of our Rochester office. I'm in the Stratham office 1 day a week. Obviously, it's easier for you to go to Stratham than it would be for Rochester, but you call me in Rochester. That is the ServiceLink number, 603-332-7398. You ask for Andy. And just say, I was at the Houston Library when we did the Medicare seminar. We can can either talk over the phone. If you're good using the internet, we might be able to both go on the internet without you having to leave your house. Or we'll find time to have you come up to the Stratum office and we'll talk about your particular company. Okay? Two other things that I do want to point out. The federal government and the state government offer subsidies to help people pay Medicare costs. So again, roughly, if you're married and your income is less than $2,200 with assets around $20,000 or less, assets means money in the bank, income, etc., you could qualify for some kind of subsidy. Feel free to call me and we'll talk about it. If you're single and your income is about $1,600 and your assets are around less than $15,000, call me. We can see about getting some help from either the federal government or the state government. The other thing is, are either of you on Medicare? Okay. This is a very important thing. That's unfortunate. This is very unfortunate, but there's a reality that's happening right now. We're getting reports, and it's happening across the country, but it's been happening a little more frequently locally. People are getting COVID-19 kits delivered to the house they did not order. The state of New Hampshire, we're taking this very seriously. And it's my job for both the ServiceLink offices in Stratford County and Rockingham County to spearhead ServiceLink's efforts in making sure this gets reported to both the New Hampshire Department of Health and Human Services, who are under a subpoena from the Attorney General of New Hampshire to turn over evidence, because they're going hard after who's doing this. The Office of the Inspector General and the Center for Medicare Services in Boston. Please, if that happens to you, please call me.